subcutaneous emphysema. Introduction. Accumulation of air in the subcutaneous cellular tissue at the level of the neck, less frequented of the thorax, head, or abdomen from neurothorax or pneumodiaphragm. More rarely is caused preference of the digestive tract. Video.
Subcutaneous emphysema occurs when air gets into tissues under the skin. This usually occurs in the skin, covering the chest wall or neck, but can also occur in other parts of the body. Subcutaneous emphysema treatment: swelling of the neck and chest pain, sore throat, neck pain, difficulty swallowing, wheezing and difficulty breathing. Subcutaneous emphysema treatment. Subcutaneous emphysema is not a curable disease. Once lung damage has occurred, it cannot be reversed. The goal of treatment is to stop further lung destruction and preserve lung function. The patient needs to know that the focus is on improving quality of life and limiting the intrusion of emphysema on daily activities. Subcutaneous emphysema tends not to be the primary cause of death, but can be a contributing factor to other organ failure. Subcutaneous emphysema is a common disease, yet every individual needs unique treatment and care. We encourage people with subcutaneous emphysema and their families to about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about subcutaneous emphysema and how to treat subcutaneous emphysema, just click on the link at description or visit www.bainmd.com.
Nursing application. Aerosol therapy was applied according to optional prescription. He was given bronchodilator according to medical prescription. He was given mucolytics according to medical guideline. The amount and type of sputum expiration was controlled. Cough was stimulated during of after postural drainage. Video.
So we have been asked to identify the sign seen in this chest radiograph. So what we see here are abnormal black lines in the soft tissues here. Everywhere in soft tissues there are these abnormal black lines. We know that black lines, black on a chest x-ray means air. So basically there is air in the soft tissues. That is why the diagnosis becomes surgical or subcutaneous emphysema. Next, to identify the sign, what you see here is the pectoralis major muscle. It also contains this air. So those are like the black lines, the black striations in the pectoralis major muscle, which is similar to this ginkgo leaf. So that's like the pectoralis major muscle with these striations, the black lines resembling the air. So that is the ginkgo leaf sign seen in surgical or subcutaneous.
Issued at plate in Ecuador. Most of the publications are case reports and a small series. The large series of patients involved the clinical significant subcutaneous emphysema described by Serfolio. There are post-operative patients With pulmonary resection, the application of aspiration and the placement of new thoracic drainage can resolve more than 70% of cases. In the rest of the case, thoracoscopic treatment choice. Video.
Yeah, it bubbles out.
It's still like she's pushing on your left and it's still bubbling out of your right too.
Really?
Uh-huh.
That's amazing.
Well, Bubba, you know what? I'll show you the videotape later. No, you laugh. You're not going to laugh when you see it later. You're going to say, wow, that's cool. Don't show it to Mom, whatever you do.
I'm still around, I want to see it.
Yeah, you'll be around. That's what I'm making this for, you. You're fascinating bubble boy.
Yeah, for people that haven't seen it before, it's definitely different.
Well, maybe some of the doctors and nurses would like to see it.
Yeah.
I'll be happy to share it if you
And that's why I brought Jackie in, because I said, you know, she's new and I knew she hasn't seen it to this extreme.
Yeah. I'll show them a before picture of his face too, although it's pretty clear that this is not normal. Look at your face. Oh. Bubba, you're a tough guy.
Oh, no.
Yeah.
I guess this is doing big time. It feels good. That's why I'm saying.
Yeah, you're getting a deep tissue massage.
That's why I'm saying.
That's pretty good. No, you
You
don't.
just have to have a lot of money, that's all, to get them all the time.
Yeah, this is probably the most expensive massage you've ever had.
He's gonna leave a scar.
I bet it is.
Does this side feel better? Yeah?
Brush, brick pain medication, supplemental oxygen supply. Cons pulmonary collapse, which often present with a rib fracture for the fascial bone, rupture of the bronchiole, esophageal rupture. Video.
Now, one issue we're going to discuss is subcutaneous emphysema, which is basically air that enters from the pleural space and it leaks into the subcutaneous tissue or tissue underneath the skin. And it causes the tissues of the neck, the face, and the chest wall to swell. And as you can see in the picture, this man's eye is shut. That's just air that built up around his eye and it's basically causing it to close. And when you palpate these areas that is the swelling, you'll feel a crackling sensation, also called crepitus, and it'll feel like Rice Krispies or a bubble wrap underneath the skin. And you should immediately inform the doctor if you notice this, because sometimes the issue is that the tubing location is either too far out from the patient or the suction level may need to be increased. So in relation to the tubing, if the tube itself slides out from the patient's chest tube site far enough, then those little holes in the chest tube are exposed to the atmosphere, and air is going to be rushing right back into the pleural space, and it's going to cause more of a pneumothorax, and it's also going to cause the subcutaneous emphysema. Now,
Conclusion. Commonly, our subcutaneous tissues does not represent a lethal threat since a small amount are resorbed by the body onset the pneumothorax or pneumodetermy, causing the condition is resolved in the will resolve hour. In rare cases, become life-threatening condition of the other and subcutaneous emphysema resulting from mechanical ventilation can cause ventilatory insufficiency. Video. Thank you.